Hey, Dr. Anujit, welcome to the MAM Show. It's an honor to have you here, and it's a pleasure to talk to you in person. And I hope this conversation is very fruitful and very informative for our audience today. And I know it will be for me. So, why don't we start by introducing yourself to the audience, and let's begin with that.
Hello everyone, and firstly, Subhav, thank you very much for having me on your show. It is
Come on,
indeed a
sir.
pleasure. I have been a fan for quite a long time. Without further ado, let's begin. My name is Dr. Anujit Paul. I am a final year postgraduate in ophthalmology in Mahatma Gandhi Medical College, Pondicherry. But of course, I'm actually from Calcutta. Having done my schooling as well as my college life in Calcutta, I finally left home and come here to spend a couple of years. My journey has been sort of bittersweet. I'm not the quintessential ranker, so to speak. I have
Okay.
never ranked very well in school.
Okay.
I've never ranked that well in college. My NEET PG rank was far below what was considered to be a good rank. I've ranked definitely above 10K in NEET
Okay.
PG, but somehow there have been things that have fallen in my favor. Some amount of hard work beyond ranks and numbers have fallen in my favor, and currently right now I'm the co-founder of an all India NGO. I'm a peer-reviewed researcher,
Wow.
as well as the fact that I dabble into a lot of other things beyond medicine, including instruments, music, etc.
Okay, so I guess we have a lot to talk about today and a lot to learn from this journey. So why don't we begin with the most striking point you said in this introduction of yourself, that your rank was not what everyone imagines to be a perfect rank or a amazing rank, which is below 10K, below 5K, to get an amazing seat or residency of your dreams. So you said you had your rank above 10K, but still, things fell into place, and your hard work, or you did something extra, or whatever you did. We need to know about that. We need to know about your journey and how, even after this above 10K rank, you are now sitting as a final year, ophthalmology resident.
Right. So the first thing that I would probably get asked is at this stage whether the rank below 10K has made a difference in my overall education and my understanding of the clinical sciences. And my answer is definitely a no. It does not make too much of a difference. Then the question arises as to why a rank of 10K is considered quote unquote bad. So what we usually associate as good ranks are ranks above 10K.
Yeah.
That is primarily because of a number of reasons which have nothing to do with the student. It took me a while to realize it, but once I got the hang of it, it made a lot of sense to me. To give an example out to you, most of the coaching institutes, not to take any names, usually advertise a rank below 10K in
Yeah.
terms of what college they would get,
Yeah.
what streams they would get,
Yeah.
what are their options. Beyond that, what we do not realize is that the rankers above 10K, whether in UG or whether in PG, are the main doctors that are going to be there all around the country.
Yeah.
So it's kind of senseless to talk about ranks lesser than 10K and the colleges that they will get.
True.
You might not always be treated by an Amazonian or somebody from Jipmer. You might be treated by somebody from Ambala Medical College or Alapi Medical College.
Yeah.
So the whole notion behind treating ranks as high or low is kind of redundant in my point of view.
That's.
But then
that-
why have this divide?
Yeah.
The first problem with having this divide is basically there is less number of seats compared to the students who are taking part, both for NEET UG as well as NEET PG. So there is an immediate funneling of students.
Yeah.
What people fail to realize is that without a coaching institute, without an advertisement, without anything else, there would still be a rank 1, there would still be a rank 10, a rank 100, as well as a rank 10,000.
Yeah.
What these coaching institutes, etc., make us believe is that we can achieve something and we can achieve a rank between maybe rank 1 and rank 2,
Yeah.
which is not possible.
Yeah.
Either way, they will always be the first 10,000 who will be better than us
Yeah.
if we are not that good.
True.
And finally, I think it's something to do with societal pressure, something to do with the fact that our society treats ranks greater than 10K as quote unquote better ranks. But then once you get the rank, I think once I got my UG rank and I started my medical college, it didn't make any difference to me.
Yeah.
And then people told me maybe for PG it will make a difference. And I got my rank which was much below 10K. And even then it didn't make any difference for me. So for those listening out there, the only message that I'd have for you is that ultimately it probably depends on the student. And as a student, if you can carve your path and if you can make your way, there is nothing that can actually stop you. Ranks are just numbers on paper. Your marks are just numbers on paper. Ultimately, you're treating a patient, and patient satisfaction, empathy, compassion, diligence, these are the things that ultimately matter when you're in the field.
I have to agree on that. It's a fair point that, ranks, like there will be ranks always. There will always be first 10,000 and above that. And one sentence you said, like, marks are just numbers on papers. I think some famous person said, if I'm not mistaken, it was Bill Gates, that a single piece of paper cannot decide your future.
Exactly, absolutely.
I think it was Bill Gates. I don't actually remember who was it, but it was. So yeah, we are actually.
He was actually a dropout, computer science dropout, and I think he used that and his life story as an example to mention the same.
Yeah, so now we will use your life story as an example and derive this extrinsic motivation from you. So you got your rank above 10K and still you got into ophthalmology, final year, you're right now in final year. So what else you did which made you, let's say, stand out from the others? Or where else did you put your hard work into, not compensate for it, but just to stand out in the crowd? So what did you do?
So the first thing I tell interns or final year students that once you get your rank, it only matters till the day you join your college. Once you join the college, you are ultimately right at the bottom of the food chain once again. You have to still carve your way back up the food chain. And in that sense, your rank makes no difference to anyone else. It makes no difference to your immediate senior. It makes no difference to your professors. So the same thing was true for me. Nobody asked me about my rank. Everybody was just wondering whether I would get this work done, whether I would go to the OT, whether I would go for evening rounds, etc., etc. But then residency is something which is entirely different from the rest of your medical school career because you do not have any more exams, you do not have any more semesters. So what you do with your residency is up to you. You can choose to become a better clinician, you can choose to become a better academician, or you can choose to become a better researcher. Luckily for me, research took a forefront, and in spite of not doing any research prior to this, I have right now amassed about 9 publications, all in peer-reviewed journals. And this has only happened because I managed to just fling off my rank and my current identity and go in for a new identity.
Wow, that's amazing. 9 publications and all in peer-reviewed journals. So whenever we talk about research as in medical school or, pre-residency, usually the students have not much idea about research. I'm not generalizing here. Many students do research when they find a great mentor. But research is something which is usually done by residents, attendants, and senior doctors or senior people in the field generally. And medical students want to do research, but often they don't know where to start from or where to begin. So let me first ask you, how did you begin your research journey? Did you know everything about research from medical school or something? Or you found a great mentor? Or what happened that made you start research, and how did you do it?
So my research journey is the typical example of your neighbor's kid who's really small till a certain age and then suddenly has this growth spurt where you do not know how it happened. So throughout my entire undergraduate as well as my internship life, I had no clue about research. I did not even think that research can be done in college life, just as you mentioned. But then once I went into residency, I had this idea that I will have to do something. And for me, in my personal case, it was a mentor. It was a professor in my department who actually bombarded me with things. He never told me what has to be done. He never told me what he's expecting from me. He gave me a topic and he gave me something to do and he just told me to get it done. I had to Google it, I had to YouTube it, etc. And because it was a professor and because he was in my unit, I just had to do it. I had to stay up nights. So for example, the very first time I met him, he showed me a patient and he said, you have to write up a story on this patient, try to find as many resources as you can. The next day, he gave me all 40 of his publications and he told me to reference them in Vancouver style. He did not even tell me what is Vancouver
Yeah.
style. I mean, that might not be the best way to make you learn, but somehow it creates some sort of push behind you that somebody wants this from me, and I better learn how to do it.
It can be like
So
an
in my case,
analogy, like active and passive immunity. He's teaching you actively,
Exactly.
like he's maybe
Yeah,
giving you
exactly.
the toxin in a very small quantity, so your immunity, learns itself how to fight. So basically, like he just threw work at you, and he was counting on your hard work and your effort in this, and by that effort,
Absolutely.
I think you learned it, right?
Yeah, and to be honest, right then I was extremely mad at him. I was in my first year. I had ward work, I had OTs, I had this and that, and from nowhere he'd just call me and tell me this has to be done. It was something of a negative reinforcement that, oh no, I have to do this or else I cannot face him tomorrow.
Okay.
But now that I look back on it retrospectively, I understood that the everything that he had given me was something that I could do. It was never anything that was way beyond the scope of my knowledge or way beyond my abilities.
True.
He chose it and he distilled it and he gave it to me. So my research journey started right in the end. In the first year of residency is nowadays considered slightly late because nowadays you have a lot of international exams like USMLE
Yeah.
and PLAB which expect some research done by undergraduates.
Yeah.
I, in fact, did not know what ICMR was when I was an undergraduate, and I have a totally different mindset and
Yeah.
a totally different mind shift right now.
Yeah.
So I've taken these amalgamated points from what he's taught me as well as what I researched myself. Another thing that helped me and which I would like to talk about maybe in the future is COVID and how COVID has changed the paradigm of research. It is just another way to show that how a new disease can breed new research,
Yeah.
and how easy it is to think about research in terms of very simple terms. So what he did for me was slightly on the rough edge of things, but I like to smoothen it out, and once in a while I get on a chat with juniors or students or anybody who would like to and discuss research with them.
Wow.
And this discussion is very free and it's very open. It's a 30-minute session which I carry out. Anybody with any doubt can come to me and I try my level best to teach them, because somewhere you learn as you teach, and as you teach you learn as
Yeah,
well.
true.
So this is the trajectory I'm in right now.
So, if we were to, book a session with you, a 30-minute session with you, can someone who has literally no idea about research book that session, or you expect some knowledge about it, like beforehand?
I don't expect anything. I just expect an interest. You might not have a research topic. You might not even know where to start. You might know where to start. You might have your first topic and you don't know where to go ahead because your current mentor is not very approachable. For anything, I'm an open book. You can just reach out to me and we can have a quick chat.
Okay, so anywhere from level 0 to level 10, anywhere you are in your research
Absolutely.
experience, we can reach out to you. So I'll surely put the link to book that session. So if you guys are watching and you have no idea about research, the example is right in front of you. 9 publications, all peer-reviewed journals, still in residency. I think you are my mentor and he can become your mentor as well for research. So moving on, let's say you did all your research now in residency, and I am I'm not in medical school right now. For example, I am still in medical school in my 3rd, 4th year, where I don't know much actually about topics or medical literature in general. I have just done my physiology, pathology recently. I've not even started my clinical postings or etc. And I am seeing this podcast, like Dr. Anuj is talking about research. Why not get into it? I'm a 2nd year medical student. Is there scope for me as a 2nd year medical student who has relatively less knowledge about medical literature and absolutely no knowledge about research? Can I also do some form of research?
Yes, absolutely. In fact, I'll just broaden this horizon for you and tell you that I have done research with people who are not even medical students. They are my lab technicians. They are nurses. They are people who play such a big role in patient care, but we usually only associate research with scientists or doctors. We do not realize that it's anyone and anyone who just puts a scientific mindset can get into research. You do not need to have a degree or an MBBS degree or a BSc degree or anything like that to get into research. Some of my co-authors are the lab technicians that I've worked with, because I believe that even they need some sort of encouragement for doing the work that they do. So having said that, if you are a second year medical student, you can definitely get into research. One more problem which I have seen that most youngsters face is that they feel the topic for their research sample or the topic for the research study has to be something extremely rare, something never found, something that has only one association, something which has a very fancy name. But if I can add my 2 cents to it, I would say that that is not at all true. The only thing that you need to think about in research is that will it help the society at large, and does it add anything new to the existing literature? If it adds something new in terms of being rare and a new finding, then well and good. But the chances of you stumbling across a very rare finding of neurofibromatosis or a very rare presentation of Wegener's granulomatosis or Eisenmenger syndrome is hardly something that a second year, even a resident will not pick that up.
Yeah.
It is something that only in a quaternary healthcare center after the multiple gene assays and blood tests that you'll figure all this out. But what you can do is you can comment on the current system, on the current availability of tools, patient care, healthcare workers. So you will usually see ICMR grants and ICMR studies usually being accepted for community projects, projects where healthcare workers and their awareness can be increased, projects where patients coming into the community or coming into the hospital or patient screening can be improved, because these are some things that medical students can easily get into. So the scope is wide and the scope is vast, and it need not always be an original article or a review article manuscript. As a young researcher, there are many types of short communications that can be tried out as well. Once again, you do not need to have any degree, you do not need to have any experience. You just need to be interested
in research
and have a knack for reading. That's all.
Okay. So also, like, when usually people start doing research, and let's say they are a medical student or not very experienced in their field, whether they are a medical student or not, you cleared that. We don't need to be that. They are relatively less experienced. So there are different kinds of research. There is meta-analysis, there is, inpatient research and stuff like that. There is sampling, a questionnaire study, what all. Which do you think, in your opinion, is the easiest to begin with, which will require relatively less help or less, they don't have to go looking for data everywhere because they are still new, or we are still new, I'm still also new. So which is a relatively easier thing to begin in research if a person is interested?
Absolutely. So there are 2 things that I would suggest. The first thing is, if you feel your hospital or your professors or your department are very friendly when it comes to research, you can always casually go and tell them that you are interested in research, and they would usually hand over a case report or an interesting image or an interesting scenario to you. So what a senior would expect is for a junior to do a search in literature, which is basically called a review of the literature about the current existing, information that is available, and write up the manuscript. So this is something anyone can approach their consultants or the senior PGs or maybe an intern who is in the ward and write it up and offer your help to them.
Yeah.
Just like as a YouTuber, maybe as a video editor, you offer your help to someone, or as a content creator, you offer your help for nothing in return.
Yeah.
Similarly, a medical student can also offer that. But there are many cases in which your medical college or your immediate surroundings are not very research friendly. So in this case, there is another type of manuscript which is called a letter to the editor. So this is basically exactly.
I have discovered this recently, working with you, like when we were having discussions about research, and I told you, like, why is this in PubMed? Like, what is this? And I had no idea something like this exists. So yeah, you can tell us about this letter to the editor. I think it's a very interesting thing not many people know about, especially us medical students.
So since you're interested, and for the audience as well, I'll mention the history behind the letter to the editor as well. So a long time back, journals would only exist in print, unlike the 21st century where you can just click PubMed and open it. So when these journals would come out, because they would go through a very rigorous vetting process, it would take a lot of time. And in that point of time, maybe something new would be discovered, or a new perspective which the reviewer hadn't thought of would come into print, would not make it into print. So what would happen is that to make the journal very accessible to the people who are reading it, the editor would accept letters. So if you read a study, maybe in the 1980s, about maybe histoplasmosis and the role of interleukin 5 in histoplasmosis, and you thought that the authors mentioned something that they could have done, or they could have done better, or they should have done better. Maybe the reviewer also missed it, maybe the editor also missed it. But it can happen that since it's getting widely circulated, some other person who is a doctor or in that specialty might pick it up. So then you write to the editor and you mention to the editor that I love the article on histoplasmosis and interleukin 5. However, the role of interleukin 5 in the presence of maybe interleukin 7 could have been discussed by the authors, or could have been elaborated by the authors. So then the journal becomes a two-way communication. The author and the editor and the publication house do not become the gods of the journal. They are subject to scrutiny by the audience as well. So this is how a letter to the editor came into being. But in more modern times, it is roughly a 200 to 300 word paragraph with about 2 or 3 references, a maximum of 5, where you can choose to mention something of public importance to the editor to be included in later editions, or you can critique a journal in a very healthy way. You can pick out something that could have been discussed or could be important and talk to the thing. So a letter to the editor, now coming back to my original point where I was mentioning case reports and stuff like that. So in case you feel that your hospital or your department is not very friendly with journals and getting published, etc., you can always pick up a journal of the department that you're in. For example, if you are an intern who is posted in ENT or in dermatology, pick up the Indian Journal of Dermatology, pick up the Indian Journal of Anesthesia, read through the article. I am sure with 4 years of MBBS knowledge, you are able to critique an article. Find a critique for an article and write something about it and just send it to the journal. So these are very easy ways of actually, when you are going into high volume publication, this is a hack for getting more publication because it's very easy to write a letter to the editor. But for those starting off, my suggestion would be to get yourself acquainted with reading journals. And once you read journals, you will yourself think about something that could have been done, something that you would like to do, something that you would like to see. And it just takes about 45 minutes to 1 hour to write it down and just get it vetted by someone who's a senior and then send it off to the journal. So these are my 2 suggestions.
So I'm pretty sure when the COVID happened, there would be a lot of letter to the editors about, COVID is alarming.
I'll give you a very good example here. Exactly. So there were a lot of articles on people who tested COVID positive and then some disease or something that were investigated. For example, central retinal artery occlusion in COVID positive patients. Or tuberculosis in COVID positive patients, or rheumatoid arthritis in COVID positive.
Everything had a letter to the editor.
Everything had a letter to the editor. For example, the authors took COVID positive patients who were positive by nasopharyngeal swab and then maybe checked out the patients who had maybe rheumatoid arthritis and did some study on it. Someone wrote a letter to the editor mentioning clearly that the authors did not confirm the nasopharyngeal swab with some other method of testing, or the authors did not grade the COVID as mild, moderate, severe. Therefore, the study does not hold up because in tuberculosis patients, you would want to know the category of COVID that was mentioned. In mild, moderate, severe also, if you remember, the AIMS protocol came out and then there was a different protocol for classifying them. So people just wrote letter to the editors left, right and center. And for each thing, the editor understood that maybe the author should have done this and changed everything and published a letter to the editor so that the journal becomes accepting to any mistake that it can make. It becomes open. And young researchers like you and I get one small publication in the middle.
Okay. So we've discussed, I think we've covered a lot about research. We've discussed about your pre-residency journey, about the ranks and everything. Now, before moving on to your residency journey, talking about, you mentioned the NGO, let's have some fun segment in between where we talk about you and maybe try to gain some humor out of your answers in a fun way. So let's begin. First of all, to lighten the mood, let me just ask you, like, what are your hobbies? What do you do when you're not in the wards, when you're not in, your hospital? What do you usually do?
Right. So I'm a big advocate of normalizing having fun during MBBS and normalizing having fun during residency. I think in India, especially, there is a huge stigma associated with a doctor who dances or a doctor who creates a reel or something like that. I don't know. I somehow see a small cringe in people's heads when they see something like that. Maybe he's not that good a doctor. Maybe he's not going to his clinics. Maybe he's not studying and he's doing all
And
these
that's
things.
why he's dancing.
And that's why he's dancing. That's why he's such a good dancer, because he does not go to the wards.
Yeah.
So these are some things which I don't relate with. At the same time, when I got into MBBS or when I got into my MS degree, I always knew that the other 150 people who took MBBS, who took the degree with me, would also pass out with the degree at the end of 4 years, maybe 6 months late here and there. What am I doing that is going to be different? What am I getting extra other than my MBBS degree? Similarly with my MS degree, this is what actually STEM research and STEM Doctors for a Cause as well.
Yeah.
Whereas I keep asking myself that 3 years later, I joined MS in 2019, I'm going to pass it in 2022. The other candidates who are with me are also going to pass out in 2022. But what am I going to do extra? So keeping these things in mind, actually, my hobbies actually stem from these questions that I have. So I'm also a trained violinist as well as a trained pianist. I'm a concert pianist with a grade 5 from the Trinity College London and a grade 6 in violin from the Trinity College London. I also picked up a lot of music theory in the middle, which allows me to somehow dabble in and learn more instruments. Subsequently, I picked up the guitar, the flute, the harmonica, and somehow all these things helps me keep sane. When I know that things are not going right in work and things are not going right in college and something is due and my thesis is due, that's just one part of my life. My life is not just submitting my thesis and being in wards and being on 24-hour shifts. Yes, that gives me a lot of excitement. And that's actually the dream. I mean, from first year, we've been all doing this. But somehow this other part of my life, these hobbies are things that really help me out. And for anybody who's listening in who had a hobby in school or in UG and has somehow left it, let me be the first person to tell you that I'm the person who just took up a hobby and left it and took up one more hobby and left it and took up one more hobby and left it. But I kept coming back. I have always tried to come back to each and every hobby that I have taken up. And even though I started music sometime when I was in class 3, I stopped it in class 10 and class 12 to do well in ICSC and ISC. And then I stopped it again maybe during my NEET PG preparation and my final MBA preparation. But I've always come back. So if you're
on and
listening
off always.
and you feel it was on and off, but I'm glad it was on and off, because if it was on all the time, maybe my life would have taken a different trajectory. But if it was off all the time, I think I would be more upset. Because that was something that actually defines me more than my MBBS degree.
So you have to find the right balance, and you did. And because of on and off, you also found a lot of hobbies: one instrument, second, third, fourth, fifth, and I don't know how many. Okay, talking about hobbies, let's have a quick rapid fire round with you. We'll have some questions. We'll have some questions for you on the spot, and let's see how your answers are, and let's have some fun. Okay, so let's begin with, and you have to be quick in this. Okay, I'll be asking you questions quick, and let's answer rapidly, rapid fire. Okay,
absolutely.
So I'll be reading the questions from here, and very quickly, let's begin. This or that. Okay, DC or Marvel?
Marvel.
Rock or rap?
Rock.
Morning person or a night person?
Oh, I'm a morning person.
Apple or Android?
Apple.
Laptops or iPads?
This is like a thing that's been plaguing all of us. I want to say iPad, but I can't. I have to say laptop.
Inpatient or outpatient?
Definitely inpatient.
Okay.
It's much more relaxing.
Sunset or sunrise?
With morning comes sunrise. So.
Okay. So, what do you think when I say these following words? The first thing that comes to your mind, okay? Fruit,
Oranges.
doctor,
Compassion.
money,
We all need money. It's better to cry in a Ferrari.
ophthalmology,
I don't want to say love. I just want to say passion. Yeah.
music,
Passion again.
research,
Research. This is my sidekick sort of a thing. I don't have a word for it. I'm still trying to figure out what role it plays, but
okay, technology,
technology, we need it.
hobbies,
Boon more than bane.
hobbies,
Encouraging everyone to take up a hobby ASAP.
Twitter,
Twitter, celeb fields.
okay, YouTube,
Minor celeb fields.
YouTube,
YouTube is like sleeping ka goli. Like at night, it's always on, and I know I'll fall asleep.
okay. So let's have some quick questions now. I'll give you some scenarios and let's see how you answer them. So if a movie had to be made on your life, first of all, what genre it will be and who would play you as the main character?
Right. So I've always felt that I look a little like Benedict Cumberbatch. I don't know if a lot of people will hate on me for this, but I feel he should. I feel he should play it.
Benedict
And,
Cumberbatch, if you're listening, please play Dr. Anujit Paul in a movie.
Yeah, you can finish off all the Marvel movies
Yeah.
and play me a little later. So
Yeah.
anyway, and maybe it would be it would. I'm a huge narcissist, so I think it would be called The Ostentatious Life of Anujit Paul.
So it would be a movie about all about you. Yeah. Okay. So describe yourself, since we are moving on the topic of narcissism. Describe yourself in 3 words.
I'm a huge narcissist. I believe that if I will not love myself,
Yeah.
who will love me?
Yeah.
And finally, I believe in a good night's sleep can change a lot.
Yeah. So if you were stranded on a tropical island, what would be the 2 things that you would take with you?
I take any device on which I would have an Audible subscription because I am absolutely addicted to Audible. And the other thing I would take is maybe a glass of juice or something like that. But I'd need my Audible subscription. If I'm not doing anything, there's always Audible on.
I would say take Audible with a Wi-Fi router or something.
Yeah.
Okay. So if you won $1 million, just right now, what is the first thing you will buy?
Difficult. I would actually invest a lot in my NGO because to be honest, I understand the notion of earning money during medicine, but I also understand the notion of giving. So my NGO is my way of giving out to the environment or the public.
But what will you buy first for yourself? Like first thing that comes to your mind. What will you buy? It's $1 million. It could be a car. It could be anything. It could be a small thing also.
I'd buy a really, really, really good mattress.
Okay. It's all about that good night's sleep, huh?
Yeah, absolutely.
Okay. Last question. Who inspires you the most? Could be anyone or anything.
At the very outset, I would like to say my parents inspire me the most because they've literally come from nothing and they've made a lot just by hard work. I can see how hard work can get you somewhere. There's my ophthalmology HOD said something to me very recently that actually changed the trajectory in which I was leading life. Maybe not so much, but I think since you mentioned this question, I'll mention it. He told me that right in the beginning of your residency, you will have no patients. Nobody will come to see you. Nobody will want to get a consultation. People will always go to the next highest corporate hospital. But even if a mosquito enters your clinic and you decided to open your clinic from 8 to 4, your clinic should be open even for that mosquito, because that's how it's going to start and that's how you show your diligence. So words like that really stuck with me. And I mean, previously I used to think about micromanaging time and outsourcing time and a lot of things that come with being a very productive, hungry person. But this is something that stuck with me. So I'd like to mention him as well.
Okay. So with that, we end our rapid fire round. And your answers were amazing. We had a lot of fun listening to them. And since last thing we talked about was inspiration, well, I can take some inspiration from you, and we will segue to the topic of NGO, because NGO is something, or the art of giving, I would say, without expecting anything in return, is something very noble, I feel, and something everyone should do, whoever can, whoever is fortunate enough in their life and they can give. So I'm very inspired by this, and I will surely be contributing in your NGO, and I have done some other NGO work myself, but that's a topic for another day. First, we'll talk about you. So, how did you come up with this Doctors for a Cause NGO, which you are a co-founder of? So tell us all about it and like everything about how did it start and where is it now?
Right. So at the very outset, I'd like to mention that DFC has been a huge team effort. By mistake, if I say I or me or something, it's actually we and our. A lot of people have put in a lot of effort. It's just not my effort, though me and a couple of friends have founded it. So back, maybe I'll mention how we founded it, and then I'll mention some principles that I picked up, and I feel that these are some principles that have really helped me grow as well.
Yeah.
And right, so in final year, I'm sure every college has a college fest. So similarly, our college also had a college fest, and since we were in final year, we were the organizing batch. And after the fest, whatever leftover money remains from the fest is usually used to throw a huge party. Unofficially, there's booze in the party and this and that. So the year when I was in final year, the cultural secretary as well as the general secretary were all my good friends.
Yeah.
And we came up with this idea that instead of spending all the money on booze, we can buy our own booze.
Yeah.
We can spend some money and Dutch all the food.
Yeah.
And we had around 6,000 that was left over from a huge fest. And we decided to take all that 6,000 and donate it to a orphanage.
Wow.
And so the name of the fest was called Plexus, and we called the effort after that as Plexus for a Cause, so that we wanted to associate some good work with that.
Yeah.
And what actually happened after that is the most surprising thing, because there are a lot of people who we realized will automatically do some good work. So if you take 10 people, there are always 2 people who will always donate money, who will always go and help out. And then there are 2 people who will probably never do any social work. Maybe they're not inclined to it, maybe they're not exposed to it, whatever be the reason. So that takes out 4 people among 10. But for the remaining 6 people, what we realize is that if you can act as a facilitator or if you can act as a middleman, you can not only influence them, but you can get them to do this good work. Most of them do not know where to start and how to start. So with Plexus for a Cause, when we mentioned that we are going to go out and we're going to do this thing and we're going to go to an orphanage or a XYZ and we're going to do this, the number of people that showed interest was phenomenal.
Yeah.
Because they didn't have to do anything.
Yeah.
They just had to show their interest. They maybe had to maybe donate another 100 rupees or something like that. Maybe come for one evening. Everything was taken care of.
Yeah.
And they love to help out. And we realized that the amount of humanity that is there in our batch that we did not even know about. So that kind of spurred on something, and we started taking that forward. And maybe for the next 6 months, this entire effort was a social group within our college, and we tried to expand it.
Yeah.
And it grew for about 1 or 2 years. Then our college started giving us some grants, and we decided that we want to take it further.
Wow.
And a couple of things that we decided with Doctors for a Cause going later on is that the first thing is that if you act as a facilitator for people who want to give, it works out really well. Secondly, we were all professionals. We all have dreams and goals of becoming certain specialists or certain certain types of doctors, certain types of helping other things, and other aims in within our friends and our family. So working for Doctors for a Cause might not be everyone's prime goal. However, if you keep a very, very open system where people can continuously go in and go out, there's not a very, very, very open membership fee or very open system where you have to stay and you have to go. In fact, currently, because exams are going on, everyone in Doctors for a Cause is off. There will be no posts on the Instagram page, there'll be no Facebook posts, because we believe that your primary job is to be a doctor or to be a final year medical student
Just
or
like
to be a second year medical student.
just like your hobbies. On and
Yeah,
off.
exactly. Nice one. So your job is not to go out to the community or go out and make a Instagram post in the middle of your final MB exam. You finish your exam, you do well in that exam, and then you come back.
Yeah.
Also, we realize that there is no use in trying to make Doctors for a Cause a really, really famous NGO. For that, you have businessmen, you have social workers, you have people who've devoted their entire lives to it. But the only difference between an NGO like that and an NGO like Doctors for a Cause is that for an NGO like that, because they are not doctors, they are entrepreneurs or they are social workers, if they want to get a doctor, they'll have to make a phone call, speak to a doctor, find out their availability, make sure that they're free on Sunday at 9 a.m. to go for a health camp. But for us, to find a pediatrician, it's probably our college senior. To find a dermatologist, it is probably my father's brother. And everything is within the circle. To find medicines, somebody has some paracetamol lying at home or Betnovec C lying at home. There is no effort on our side. So we made the most of that, and we started helping out larger NGOs. And that's a small story about how we grew. Along with the fact that in Doctors for a Cause, we tried, because we are inculcating this habit within medical students. They are not yet gastroenterologists or pathologists or ophthalmologists. They do not have that inherent divide that exists within medicine when you become a super specialty or when you take up a specialty. Everyone's friend. Everyone knows each other from their MBBS days.
Yeah.
That entire divide sort of goes down with this. And during the COVID times, we provided a lot of help, and a lot of people were free. So Doctors for a Cause boomed a lot. And fortunately enough, DFC right now has 6,000 members. It is pan-India. We do have representation from outside India as well. We are doing groundwork in Calcutta, Chennai, Pondicherry, Bombay, Delhi. It is completely based on when you are free, you don't give your time, you will get a reward system. There is no system about having a president and a vice president and a secretary and a bunch of MOUs and stuff like that, because we are all doctors. We understand how senseless and baseless that is. Sometimes it is important, but the most important thing to do when you are in second year and third year is, when you are free, pack your bags, start a menstrual health awareness campaign, teach people in the villages about safe sanitary practices, etc. When you are in final year, go for a health camp, expose yourself to the people who really need your help. And when you are in residency, try to get specialized help done at a subsidized cost. So we function right now in 3 strata, and somehow or the other it works. So DFC will again get active in April. I mean, there are parts of DFC which are always active, but this is just from the point of speaking of understanding a student's mindset and encouraging a student to do good work.
Okay, so what if I want to contribute to this NGO or join as a member? What should I do? Where should I go?
So we are strongest on Instagram. You can obviously DM Doctors for a Cause on Instagram.
I'll link it.
Plus there is a link in the bio. Absolutely.
I'll link it in the description.
Absolutely, that would be really kind.
No, I'll myself first have to do it before putting the link. Like, it should be an example. So that's a very noble thing and a very noble part of your life, I must say, and it definitely inspires me, and I'm sure it definitely inspires a lot of you. Now let's go on to your work side of life, the thing you've been striving for since medical school, and now you're there. You're a final year ophthalmology resident, almost going to complete now. I think you have your exams right now, right? In some time.
In a bit.
So Apart from inspiring students, being a mentor to me, you have this as a job, right? Okay, so, but when you first, got into residency, I'm sure, just like everyone else, you were also a bit clueless because after a medical student, and now you're in, residency, and again, as you mentioned before, there are no semesters, no exams. It's a whole new ball game. So, what are some general tips for people who are just going to start residency right now? What should they keep in mind, and what can they learn from your experiences?
Right. So the first thing that they can learn from my experience is that ranks don't matter and numbers don't matter. I've already mentioned
Yeah.
that before, but I feel it's worth reiterating because sometimes
Sure.
sometimes these numbers and things just bog us down, and sometimes they're only asked and it doesn't matter in the long run.
True.
The second thing, which is quite ironical for people who will join residency, is to come to terms with the fact that as a first year resident, you are truly and honestly right at the bottom of the food chain. As an intern, you would think that collecting reports and getting x-rays and shifting patients and taking them for investigation is the most thankless job. I am there to tell you that a resident's job is below that as well. If the intern cannot get it done, the first year resident has to get it done.
Oh,
So
I,
you are the
I
true
always
bottom
thought
feeder.
it was the opposite. Like if
Absolutely.
whatever,
And so did
like if no one can get it done in the hospital, no one has time, intern has to do it. I always think like that.
Yeah, so what interns don't realize is that as an intern, you can just take a day off and you'll get 1 day extension,
Yeah.
but then the resident will have to do your work.
Yeah.
But as a resident, you have no option to take 1 day off. So, so I say this in as a very light thing, but sometimes it can get to you. So the whole learning point from this is that if you can fix your mind as that you are the bottom feeder, you can also fix your mind to think that the hospital is running because of you. The patient is making it from point A to point B because of you. A patient is getting discharged because of you. A patient's life is getting saved because of you. There is no one stopping you after maybe the usual work hours from 8 to 4. You are in charge. You can get a lot of stuff done. And if you can just, as a first year resident, get that notion out of your head that what am I doing? Why is this my work? And change your mindset to something like, I get to do this. This is my work. Maybe I will get to learn something from this. That is the biggest advice I can give you as a final year resident to a first year resident.
Yeah.
Take it as it comes. Don't worry about it. It will get better, and it does get better. A couple of more points that come to my mind that I would like to say is that till you are a resident, you still have the luxury of waking up in the morning and taking a glass of water or taking a cup of tea and sitting to study, sitting with your division papers and all that.
Yeah.
But once you become a resident, all that goes out of the window.
Oh.
That the first day as a resident is the last day that you are only a student. From now on, your study timings might start at 2 a.m. at night. It might start at 8 a.m. in the morning. It might start at 4 p.m. in the evening. But somehow you have to make time for studying. And that is something that usually we tend to forget. And finally, the most important thing as a resident is that you finally are a doctor and you finally are in your dream branch, and you are finally allowed to treat patients, obviously with some amount of help and some amount of guidance.
Whatever.
But exactly. But the treatment plan that you make will only be approved by your consultant. The consultant no more will treat the patient anymore. So go all out and find out something interesting. Consult with your consultant and ask him that, may I change the dose of this drug? May I add this drug? Try to see what it does. Don't treat every case of fever as every case of fever, or every case of headache as every case of headache. Because this is the time where you get to exercise your skills, but you're still under an umbrella for safety.
Yeah.
So make the most of your study time, publish papers, get into research, try to find out what other departments are doing, try to understand more about other departments and their recent advances, and mostly just have fun. Trust me, once you get the idea of the work culture out of your head, it's actually a lot of fun to be a resident.
So eventually we will learn to have a balanced life. You mentioned all the points we can expect life will throw at us. but eventually it's the balance we will have to find, and we will find that, and we have taken that from your experience. So you mentioned about studying, and you mentioned about research. About research, you've already covered a lot of it. Jumping on to studies, as a medical student, when we are preparing for entrance exams, there are a plethora of resources we can dab into, online, offline, different kinds of books. What resources should or does a resident use? Like, are there any resources, like similar resources, or something different, or research is the resource? I don't know. What are your comments on this?
So, no matter which field you're in, you will definitely have a parent book, and that parent book needs to be known from cover to cover, because that is the book that will determine whether you pass or fail. That is the book whose guidelines you will follow to treat a patient. So, my first advice would be to decide what you are going to make your parent book depending upon your specialty, and stick to that.
So, for
The
just,
second thing
just to
which
stop
is-
you here, for example,
Yeah.
for medicine, it would be like Harrison's, something like this.
Yes, absolutely.
Okay.
Yes, but the interesting thing is that you don't need to always stick to Harrison. There are better books than Harrison which are more concise.
Yeah.
But sometimes the old timers will prefer a Harrison reference, will prefer something. So it's better to stick to the old timers going forward. So other than that, one interesting thing which will be an eye-opener for most people is that once you are in residency, any resource is a resource for you.
Yeah.
While you were in medical school, your for example, your medicine resource would only be the watered down portions of
Yeah.
Harrison in some Indian author.
Yeah.
I think it was Matthew
Yeah,
Agarwal. If
I
don't
did
remember.
Matthews.
Yeah. So you'd be stuck in these four walls where if you would study mitral stenosis, you would only study that page from Matthew Agarwal.
Yeah.
Or if you would study interception, it would be Manipal's manual,
Yeah.
or it would be SRB's surgery,
Yeah.
or it would be DC Datta for postpartum
yeah,
hemorrhage.
yeah.
But the interesting thing in residency is that anything is a resource, anything on the net. But there are two things that I would suggest. Number one is that for each specialty, there are definite websites which you should ask your seniors. If you cannot find them, the easiest resource to find anything on is Reddit. Just do Reddit / and put your specialty. You will find endless and numerous resources.
Yeah.
In fact, Reddit has a very good system of chucking people out if they give wrong resources.
Yeah.
So you can trust resources on Reddit. Right. And so the second thing that I want to mention is review articles. Review articles change the ball game. For example, you want to study atrial fibrillation. In a review article, there is one gentleman or the co-authors of the review article. All these gentlemen have sat through all the textbooks, number one. Number two, have sat through all the recent data, have analyzed and statistically found out what is important, what is required to know. And all that they have done is compile everything into 4,000 words.
Yeah.
So that 4,000 word review on atrial fibrillation is going to be way better than, for example, Harrison or Davidson
Yeah.
or any other Matthew Agarwal resource that you get. So my first tip and trick would be to ask your
Review
seniors.
article.
Secondly, just go to reddit.com / your specialty. And finally, if you see something in the OPD, for example, you see rheumatic fever, just go to PubMed, type rheumatic fever and type the word review article. It'll definitely be one of the first three links, and it'll be more than enough for a long question, a short question, patient care, a conference, anything.
Okay, so these were the resources about residency. So you have to research, you have to study, you have to do your day job, you have to manage your hobbies. You also have to shoot podcasts sometimes, like you are. You also have to do some guidance sessions. You have to be a mentor to medical students. Lot of things to do, right? So how is a work-life balance for you as a ophthalmology resident in the final year?
Right, so I don't remember who mentioned this quote, but I remember the quote very well.
Just like I did.
Goes by, yeah, just like you did, but you at least had a name. I don't even have a name.
Okay.
Somebody listening to this might be like, oh my God, he doesn't even, let's not go there.
Yeah.
So I have this quote in my mind, and it goes like we all have 24 hours, but we all don't have the same 24 hours. So
I've read it. It goes on to
it's
further expand itself. Like if you have this, you have this. We are not the same, or something like that.
right. So the way I get work done is mostly outsourcing the things which I don't need to do personally. Waking up early. I don't know if majority of the people who are listening to this podcast are night owls or early risers, but I personally believe that if you can wake up 1.5 hours early or even 1 hour early and crank in that 1 hour for anything that you like to do. It can be for your exam, it can be for a podcast, it can be for some new hobby that you're trying in. The return on investment that you will get for that 1 hour, even at the end of 20 days or at the end of 1 month, is phenomenal. So if you are in residency or in internship or studying or anything, a lot of people believe extensively that taking care of your body is also some sort of work that should be in your work-life schedule. And that is also a very good way of thinking of it. But if you're feeling that you're struggling with time, if you're feeling that somehow you hear a lot of podcasts and you see a lot of YouTube videos, but you cannot, start that new instrument or search for that research paper, just try going to sleep early. And no matter how groggy you feel, just put an alarm, wake up, and take a shower or wash your face and get to work. If you do that for at least, there are a lot of theories about 14 days and 21 days being habit forming, etc. But just get up and do it. That's all I would say. That's exactly what I do. And that helps me maintain a good work-life balance. I wouldn't say I have the best work-life balance. I also falter a lot. There are a lot of things which are on my to-do list, which I never get done. And I just
that's why there's
go to the thing and press tomorrow.
That's why there's a thing called backlog. There's a reason
why it's backlog. And these to-do apps have this thing called tomorrow, and you just so want to press it. So, but if somebody asks me that how did you manage all this, the only thing that I would say is that I didn't let my rank bug me. I did whatever I wanted. I kept asking myself, what else can I do with my degree? What else is possible? And if I want to take out more hours in my day, it's usually in the morning. If you feel it's the night for you, it should be a night without any distractions. But in the morning shows the day. So
if you're a night owl, as long as you're getting that extra hour, it should be fine, right? Even if you're a night owl.
Yeah, exactly. If you're
brings me relief. I'm not really a morning person. I always try to be. I'm always like, from tomorrow, like, might not sound early to you. Like, from tomorrow, I will wake up at 8:30 a.m. I'm not an early riser. I know, even if I'm in bed at 12, I will sleep by 2 a.m. I'll just keep, I'll just stay in bed. So I'm always like...
So, if I may interrupt you here, the trick that you can pick up over here is that just wake up at 5 a.m. in spite of sleeping at 11 p.m. Take a cup of coffee or whatever you feel is your caffeine source, and just stay up the whole day. The next day you are bound to fall asleep at 9 p.m. Because as a resident, my sleep cycle also gets totally messed up when I'm on duties and I'm on call. So there are multiple nights when I'm up till 2 a.m. and I wake up at 7. But the very next day, I just change my schedule and again wake up at 5. I am dead sleepy by 7 p.m. but I somehow make it till 9 and my sleep schedule comes back.
Wow, sleeping at 9 p.m. I don't think so I can ever do that in my whole life. But yeah, it's maybe not 5 a.m. but like as I said, early for me could also be 8:30 because I've never been a morning person and I always try to be a morning person. And finally, I will achieve this, and I will surely make a video on this when I achieve this, like how I.
You can make one on 30 days of waking up.
I will
or
do
8 a.m.
Yeah, the thing is, I have football matches at night, which start at 12:30 a.m. and they end at 2:30, and they are like more than a hobby to me. They are love. They are my love. I can't miss them. That's why I always, succumb to it, and I'm like, no. I will watch the match, because who watches the match recorded? You watch it live, right? So yeah. Anyway, but I will try my best to do that. It was nice talking to you, Dr. Anujit. We learned a lot from you. We had some fun segments, some good discussions, some inspirational discussions. On and on, it was a very informative session for me and for the audience for sure. And we will have all the links to how to reach to you. I am sure we did not talk about this, but you have a very interesting Twitter account, and you post a lot of content there, and sometimes it gets a lot of attention and people randomly share it. And I found out that I had shared it before when I did not know you, because
Right.
in our Instagram chat I had literally taken a screenshot of your tweet that I found myself on Twitter, and I posted it, and you happened to see it and you replied to my story. Like, it was in my chat history. So yeah, you have a very interesting Twitter content, and
The
I
trick with Twitter is to be just slightly
yeah,
controversial,
yeah.
and that does the trick.
So if you've not checked out Sir's Twitter account, I will link it. Like, the first link would be that, the second link would be you mentoring students for research, and the third link would be how to reach you, how to reach the NGO, the Instagram page of the NGO. Wow, we've discussed a lot, and all these links will be down in the
Absolutely.
description box below. And thank you so much, sir, for having this conversation with me. And yeah, that's about it. And maybe we can have another podcast session about something else you discover in your life after passing this residency phase, and we will all relate to that as well, maybe.
Thank you so much, Subhav. Honestly, I mean, you're going to cringe when I say this, but it is truly a fanboy moment for me to be on your podcast. I have been following you for a really, really long time.
Thank you so
And
much.
I do know about what you're doing. And somewhere I relate to people who give me inspiration. And just like you mentioned, you are someone that gives me inspiration, somebody who's actually thought about more about MBBS more than just the subjects and the 19 subjects or the 14 subjects that are included. And you're doing so well with that. And I wish you all the very best. I hope we meet on much more interesting terms. I hope we meet in person
We
very
will,
soon.
we will, for sure.
We will. I'm sure we will.
Yeah.
I'm sure we will.
So thank you so much.
Definitely. Thank you very much.
Yes, bye bye.
Bye.
And I will just say this, if you want to check out behind the scenes of how I filmed this podcast, you can check out this video over here. And until then, stay safe, stay happy, and stay mad, but just about medicine.